Okay. आवाज येतोय मला? Okay. A very good morning, dear speaker, dear student. Thank you so much for joining us. Hope you are fine and safe at your places. I, Rameshwar H. Cheke, working as assistant professor, Department of Pharmaceutical Chemistry, Dr. Rajendra Gode College of Pharmacy, Malkapur. I welcome you at a live webinar on expert talk on GPAT 2021 preparation strategies on behalf of Dr. Rajendra Gode College of Pharmacy, Malkapur. I welcome you all again with the permission of below speaker, Mr. Sagar Channe for session 1, and he will be deliver his presentation on preparation strategies for GPAT 2021. So every pharma student has a dream to be a GPAT scorer or qualifier, but not all the students get it. For this one need to be hardworking, determined, and well planned for GPAT study. So our speaker will talk on various strategies for quality or to qualify the GPAT exam. So I will take this privilege to introduce below speaker, Mr. Sagar Channe, and his topic are preparation strategies for GPAT 2021. So without taking much time, I will be introduce the speaker of today's session, Mr. Sagar Channe. Mr. Sagar Channe has completed his graduation from Anuradha College of Pharmacy, Chikli, Maharashtra, India. He has done his post-graduation from Institute of Chemical Technology in Pharmaceuticcs. Uh, Talking about his achievements, he has secured All India rank 39 in AICTE GPAT 2016 examination. He also secured All India rank 368 in NIPER JEE 2016 examination. Moreover, he secured All India rank 56 in Bharati Vidyapit CT exam. So currently, Mr. Sagar Channe working as a research associate, pharmaceutical formulation, oral solid dosage department, Abbott Healthcare Private Limited. So with the permission of speaker, I will hand over control to Mr. Sagar Channe. Sir.
Hello, you can hear me, Ram?
Yes, definitely.
So thank you so much for such a warm welcome and such a overwhelming introduction of mine. So I'll share my presentation.
Yes.
You can see it, right?
Yes.
So very good morning, you all, for joining the session. I hope everyone is fine and taking care of their loving ones in this situation. So regarding GPAT, and I'll tell you one thing, this is the biggest opportunity for you, and you have a lot of time to study. So use benefits of this time. Don't waste this time. I know sometimes it is frustrating and disturbing that number of patients has going increasing on, but still at your age, so see, you cannot do anything. So the warriors are fighting, and you should concentrate on your, because you will be the warrior one day once you complete your education, because we are the maker of medicines and vaccines. So proud of yourself that you are doing good thing, and use, I will say, use this opportunity for qualifying GPAT and studying for pharmacy. So during the presentation, if anyone face any difficulty in hearing me, please let me know, so we can
Yes, yes, we definitely let you know
solve out.
any difficulties.
Okay, I will start. So the background of slide says, do not study hard, study smart. Means in GPAT, you should consider this, that you don't have to study very hardly in night and day. You just have to study. Don't think like that. It is not like that. You have to study smart way. So we will discuss what is GPAT in concise form. So it is Graduate Pharmacy Aptitude Test. So it is national level exam conducted by, before it was conducted by All India Technical Education, that is AICTE. And from 2018, it is conducted by National Testing Agency. So it is computer-based program. It will be 3 hours online test uh, conducted by uh, it is online test, so you will be having 125 question with 4 option. Each question will carry 4 marks, and if each wrong question will carry negative marking of 1 mark, that is 1/4 mark will be cut from your all marks. So let's see what is the benefit of this examination, because everyone will be looking for benefit. What is the benefit you will be getting? So it's good thing, because you need something in if you are working hard, you need something in return. So if you qualified GPAT, you will be getting stipend for 2 years for pursuing your MPharm, which is I think very good thing, because everyone need financial assistance once you are graduating. Your family is not going to provide you. Some of you may be having that advantage. Your family may give you money for that, but most of us, we need financial assistance after graduating from BPharm. So you will be getting that for pursuing your MPharm. Another thing is, you will be getting admission in PhD also. You know, the GPAT score is valid for 3 years. So 2 years, if you complete MPharm, and if you want to get admission in PhD, so you can get on the basis of GPAT. Second important thing is, if you secure good rank in GPAT, you will be getting admission in premier institute. I'm not saying other institute are bad, but it make a difference. If you are in good institute, it is very good for getting placements, and you will easily get place in good company, and it will make a reputation to that. If you are good rank with GPAT qualified, it will help you in future. Believe me. So these are the certain benefits you need to understand. This is important, and this will benefit you in future in your throughout your career. And see, graduate pharmacy aptitude test, as the name suggests, it is aptitude. It will develop your aptitude thinking. Means once you start the studying, no, you will come to know that my thinking has been changed. So it definitely it will help in future also. So you need to remember some important thing before starting preparation for GPAT. You need strong motivation of doing. If you don't want to do, stop it right now. If you really want to do, have that motivation that I'm going to do that, and I'm going to qualify the exam. Keep this positive thinking with you. So keep strong motivation of doing it. Then second most important thing is, I know most of the people, they waste their time on phones. Whether it is Facebook, it is WhatsApp, but remember that it is taking your lot of time. If you calculate how much time you spend on your phone, just do it for weeks, you will come to know how much time you are wasting on your phone. See, some people tells me they are we are reading MCQs on Facebook and WhatsApp. It is not going to help. Believe me, it is not going to help at all. You have to read a textbook. You have to understand the concept properly. Then only you are going to think in GPAT examination. Then you are going to get that approach of thinking during examination. So another thing is keep regularity in you're doing. If you are starting from today, keep it regular. I can understand 1 or 2 days. So you need that motivation of keeping that continuity. If you keep it regular, it is going to benefit you definitely. And generally, it is tendency in pharmacy. You can see big books are there, so you get scared to books. Don't get scared to book. You don't have to read all books. No one reads all textbook, all chapters. But the books are the detailed knowledge. If you want to develop your basic concepts, read it from book. Don't read it anything from any notes, and read it from books. Then everyone has some question, whether it is UG, means be from first year to second year students or third year final year student. These common questions are means even I have also faced this common question, because if you look at syllabus, there is vast syllabus is available, around 50 56 pages of syllabus is available. So don't look at syllabus, I am saying, because syllabus is the same as your BPharm syllabus. So don't worry, because you just in GPAT you have already read in your semester examination, but what you have to do, you have to just revise and understand the concept more detail. So don't go directly for MCQs. Don't refer to MCQs book directly. I'm suggesting, if you now, those who are going to appear in 2021, you have around, this is July, you also have a lot of time to do. And those who are on third year, you have really lot of time to do. But during your sectional exam, during your semester exams, study it as a GPAT point of view. Don't mug up it, but study it as a GPAT point of view. Because if you are thinking of because that is the time you are wasting on in mugging up. Take that time as a, because you are not going to fail. It is very difficult to fail in BPharm examination until and unless you don't do anything. You have, if you are studying for GPAT, you remember more points, I will suggest, because you are looking at particular what is different thing. I will come to know what you have to read and what are most important things. Before when you are starting, no, don't look at directly as syllabus, but you divide the subject, which are major subject and which are minor subject. Major subject means, so these are the main subject in our core pharmacy. These are the main subjects you need to see. Maximum question will be asked from these subjects, and minor subjects are you will find this subject in particular semesters, in second or third semester, but to study majorly these major subjects like pharmaceutics. So in our time in 2016, major questions were asked from pharmaceutics subjects. Then pharmacology, pharmaceutical analysis, pharmaceutical, uh, organic chemistry, pharmacognosy, medicinal chemistry, and minor subjects are biopharmaceutics, pharmaceutical biotechnology, microbiology. I'm not saying these subjects are not important. Questions are being asked from this subject also, but concentrate more on major subjects. That's I'm saying. If you look at syllabus, you will get mad of reading 54 pages. So I'm saying stick to subject and your semester syllabus. Divide chapters from your semester syllabus only. And another thing is, now from here up I will cover each subject and what are the most important chapters and parts to read it, and what to refer it, what book to refer. So pharmaceutics, very important subjects. So I used to refer Lackman, but Ansel is also good. Alton and BM Mittal, you can refer any book, all are set. But Lackman, it is the most commonly used book, and usually the MCQs are set from this book. So read Lackman. So what are important chapter? Someone has any questions? Because I am seeing was Radhika Kale has raised her hand. If you have any question, please ask. Hello.
Sagar, I will ask you question in last of the session. So you may continue. हाँ सागर. तुझा आवाज येत नाहीये.
Hello. Now you can hear me.
Please start.
Hello. Now you can hear me.
Yes.
I'm sorry for this technical issue.
So Sagar,
Yes.
I
Yes,
will
Ram.
ask you. I will ask you question on behalf of our participants after end of session. At the end of session. So
But
you.
please let me know if you can't hear me. Oh.
Yes, definitely. Yeah.
So I'm talking about pharmaceutics. So book you have to refer is Lackman. So I was telling about important chapters from Lackman. That is tablet and capsule. You must read it. The whole chapter, each and every part of tablet capsule, you must read it. So see, I'm covering some important chapters, not covering all chapters. But what I suggest, these chapter you must read, because definitely question are going to come from this chapter. Then another thing is charts from Blackman, because you think the one who is going to set your paper, he is going to see the books, and the first thing he's going to see is the tables and charts from the LACMA. So maximum chances are there you can see the questions from these charts and tables. So do this chart. If you find some chart is you find it very important, make a chart and paste it in your study room. So these are important chapter you have to read. Then regarding pharmacology, so books to refer are KD Tripathi, Medicinal Pharmacology by KD Tripathi. Go for Rangandale. Then for classification, use that Vikas Sethi pocket book. And hope you are familiar with all these books. If you are not familiar with this book, you can ask me at later. Then I can tell you how to go ahead. Then pharmacological classification. Do select the important chapters, or do means make a charts in big cardboard paper and paste it in your room. That is the simplest way of doing. You cannot remember it, but every morning you must see the pharmacological classification and you must read it. But because of what happened, once it is pasted in your room, you can see it on every day. Do group discussion about classifications. Group discussion in the sense, if you are doing today antihypertensive chapter, so tell your friend that I have did antihypertensive and I'm going to tell you. So what is alpha blocker, what is beta blocker, and which are a various example of beta blocker, what is mechanism of action of beta blocker, and what are contraindication. So read all this, what are adverse effects. So link it in detail. So tell classification first, but do it because it helps. If you're reading your own self and you're not speaking it, then it is not going to remember you. So do this. These exercises are very important. It will going to help you. Then another thing, I'm not telling about Lachman, but read all tables from all the books, because the mindset of setting question paper, taking question, because if you read the books, no, you will find all important examples and important things are given in the table. And so no one look at the theory part, but people look at the table part and they will take questions from the table. So read all tables from all the books. So another things to do in pharmacology is do mechanism of action and adverse effects. Remember one thing, you have to find out what is unique adverse effect. Find out, don't read common one. Nausea, vomiting, there are common adverse effect of every drug. For example, dryness of mouth. So anticholinergic drug has side effect of dryness of mouth. Remember this. You will not find other. So find out such a common one that make difference. So if you understand how to find out common one, you will get that. So that question will that question, the chances of higher chances there that such a question will come. Then read the drug interaction. Then while doing pharmacology, do clinical pharmacology side by side, because you don't give as a separate time for clinical pharmacology, because many questions comes from clinical pharmacology also. So drug interaction are very detailed given in clinical pharmacology. So read that. And in case of pharmaceutical analysis, talking about books, for titrometric analysis, refer Ogel. A small book of Ogel is there of red color. Refer that, very good book for acid-based titrometric analysis. And do refer for GR Chetwal for spectroscopy. GR Chetwal and Pavia. Do refer GR Chetwal and Pavia for spectroscopy. Pavia is very good book. I used to like the Pavia. Then in titrometric analysis, mainly acid-based titration, potentiometric titration. What I suggest in analysis, many people refer Kastura and Vododkar. It is very good book for semester examination, but I think don't refer it for GPAT. Refer GR Chetwal and Pavia. Then UV visible spectroscopy, Woodward-Fisher rule, do it. Then principle of UV. In case of other spectroscopy and chromatographic method, do the sources, what is detector use. So make chart of this. Means what is the IR range? IR range to definitely they are going to ask. Make a chart of IR range. Then other for chromatography and other spectroscopy method, make a chart, sources of light, then detector, which detector are used and what is the principle. So that is going to help. If you make the chart, that will help you reading. You don't have to go again in book and read it, and you will remember also. It will be in front of you. So I used to do this method. If you have your own method of studying, that will help you. You can follow that also. In very easy subject, that is pharmacognosy, and many questions are being asked from pharmacognosy. So everyone know the book Gokhale Kokate, and I will suggest another book you must read, that is Handbook of Practical Pharmacognosy by Khandelwal. So you must be using this book for your practical exam, but read this book. If you are not reading whole book of Gokhale Kokate, but read Khandelwal book, that is must. Question are being asked from Khandelwal book, and what are important things in cognosy? Do alkaloid chapters, glycoside chapter, volatile oil. From that, what you have to do? What biosynthetic pathway? Do it clearly. Chemical test, chemical constituent. If possible, no, in biosynthetic pathway, you remember the structures of some phytoconstituent, because I have seen some question paper. They are asking also, means, identify the structure. So remember some structure if possible, if it is simple to remember. Then for biological source, synonyms, phytoconstituent, make a chart if possible. Paste it in your room. Then these are important chapter from Khandelwal. So I have given some format for making the chart of drugs, common drugs. So put means I may make it from pens. Don't make it on laptop and print it and paste in your room. If you're writing something, if you're reading and writing something, that will remember forever. So make a chart by your pen and waste some time for making chart. It will help you. So you can do one thing. If you read all the plants, biological source, synonyms and everything, now it is time to remember, recall it. So that time sit and make a chart by remembering. If you find difficulty, go and book in read it again. Adulterated substances are also important. Then biopharmaceutics, I'll suggest only one book, that is Brahmankar and Jaiswal. So in first four chapters, that is absorption of drug, distribution and metabolism and elimination of drug, read mainly factor affecting on absorption, factor affecting on distribution, and whatever example are given in that, read that example, because many times they ask that examples. And another, again same thing, all tables. For example, I have given some table. So like this table, you must read all the tables and understand it, what is given and what is the, I can understand you cannot remember all the tables, but if you find any table is really you find interesting and you understood it properly, take it down on paper and paste it. Then this bioavailability and bioequivalence. In this case, read the terms. What is therapeutic equivalence? So direct definition can be asked. So what is the definition of therapeutic equivalence? So this type question may ask. In vitro in vivo correlation, read this. So biopharmaceutics generally, it has some tricky questions. And other questions are directly example from suppose any drug uh, drug that pass through diffusion mechanism. find out the example. So such a questions are there and examples are given in the book, in charts, you can find out that. In physical pharmaceutics, do these chapters only, rate and kinetics, what is first order, what is second order, what is pseudo order, do that term solved. Remember the equation of rate and kinetics reaction. That is very important. Equation are being asked, believe me, you will find one confirm question on equations from this chapter. Then rheology, drying, micromeritics and filtration are also important chapters. So I have not covered all the chapter. You will say you are saying only 4 chapters and what about other chapters? You do have to read that chapter, but these are very important. You must read this chapter. Then medicinal chemistry, do find time for reading Foy's, very important books, and Wilson and Gisold. Foy's, you must be scaring to this book, but don't get scared. If you read the complete chapter form, you will understand all pharmacology basics, because they start from basics. So you read the Foy's, you will first time you will, if you find very difficult reading it, but once if you read second time, third time, you will find very easy book to understand. And if you find understanding easy in other book, so you understand the concept from that book and come to this, then you will understand reading concept from this book. And in medicinal chemistry also, classification, so it will get covered in pharmacology also. While doing structure, remember heterocyclic ring present in the structures. So these are the common, means if you have any class of drug, so common heterocyclic ring are there. Remember metabolic products, that first chapter of Wilson and Gisold. Do remember metabolic product of any drug. And one small subject is that jurisprudence. So you have to read Drug and Cosmetics Act. What is from that? Schedules and form. So what is schedule Y, what is schedule M, what is schedule, for this also make a chart, I will suggest. And forms, so which are the forms required for clinical trial. So you have to mug up this, and discuss it among your friend. Then another thing is DPCO Act, Drug Price Control Act, then Pharmacy Act. So read these two, 3 chapters, that is enough. Do remember the committee members. It is chart is given in BS Kuchekar. You will find it helpful. Then apart from this, so what are the things you should follow? What are the things you should do while studying? So plan your work. So I just suggest, if you have watched syllabus, so take it as a chapter wise. If you see the syllabus of GPAT, it has given each and individual concept, but don't take it as a concept, take it chapter wise. So you can divide on your, because everyone has their own planning. So according to your timing, do the plan the work. Do plan it. So how much time is remain? For example, you have 7 months now from this month preparation. So do it month wise. I have to complete this from this month. So it's okay and it's fine if you cannot complete everything and each and every subject. It's okay. Keep it regular of doing. Don't get afraid if your friends are telling you that I have done this thing and I have done that thing. Some people have that mindset, they get scared. Oh, my friend is doing a lot of thing and I have not done anything. So concentrate on yourself. Then another thing is group discussion. What I will suggest, don't do group discussion beyond 4 people, because I have tried this. This is not going to happen. Group discussion, they will start suddenly, they will start something gossips and you will discuss that gossips only. So do group discussion, but between 2-3 people, that is enough. And who is interested, find one who is interested in really discussing classification with me, pharmacological classification with me, or structural activity relationship of some drug biology pharmacological class. So find out such a friend, he is really interested in discussion. Group discussion will recall whatever you have read. Then you will find one common thing. I used to do this: make chart and paste it on wall. So you read once, and suppose you have read and now it's time to remind that. So that time sit and write the notes. So I have read this. So you will remember that you don't have to go it again and read, and make a chart and paste it on your walls in your study room. I find this point is very important in my qualifying me as an exam, because I remember I used to paste all the charts in my room. The room was fully pasted. Then don't waste time in while preparing semester. Don't just mug up. Do GPAT point of view also, because that time you will cover some syllabus. So if you are thinking, no, now it's time for semester and you are reading one day before of exam, that time you will not think of GPAT, but start before. That's why I said do planning. So if there is a semester exam in 1 month, so you have to read. So keep your other plan of studying GPAT apart and concentrate on semester exam and study semester exam in GPAT point of view. So you are not wasting your time. Otherwise, you will separately study for GPAT and separately study for semester. That is going to. If you have your own book, I'm not saying make colorful book of library, but if you are your own book, use a marker, mark it on book. If you are reading it second time, mark it on your book, or highlighter, use as a highlighter. I'll say don't make make colorful book of library. It is not going to well, because other people will get disturbed with that. If you are own book, then what I have find this people start reading MCQ now. Suppose you have your exam in next year, so people start reading MCQs. This is not going to help. You have to read books, because the MCQ as such will not going to ask again. Read the MCQ, practice the MCQ, but in last 4 or 5 months, practice some test series. If you are reading the MCQs at last, read about all 4 options. This is going to help, because you are increasing your scope. Those 4 options are kept because of there is a something in their back of mind. If I want to create a question for exam, so I will put such a 4 option that will be related to that questions only. So student will get confused. I find this one is also correct. I find this one is also correct. So what you do now, read about all 4 options. Suppose you have 4 options, go to books. What is this option about? If it is not related at all, so leave it. But if you find this option is because you are increasing your scope, because if you're reading about options, you are reading new concepts again. And that is in because there is another point of view. If anyone want to set the question paper, he will see what was the last year question paper like. So he will not set as such as a question of last year paper, but what he will think, what were option. So what this option, if he sees in, fortunately he sees any question and he sees all 4 options, so he can go that way, that what is this option about, whether I can set any question about these options. So likewise, there are certain things I will suggest don't do that. One is already, please don't read the only MCQs. Read it at last stage, but as I said, read all 4 MCQs. Don't do group discussion more than 4 people. It is a waste of time. Uh, then another thing that's already there, don't study on Facebook and WhatsApp. So there are a lot of disturbance from your mobile. First, after this lecture, plan to keep distance from your phone, because once you take the phone, no, your all concentration on study will go, and you will go on Facebook, you will go on WhatsApp, and you will see chattings and who is calling and what. So use it limitedly. Now you are attending a GPAT lecture, so this is limited use. I'm not going to touch my phone after this, because take beneficial thing. See what happened. I can understand many people, they post their questions and important question on Facebook, but there are a lot of disturbing thing. You cannot concentrate. So another last thing is, don't read only. You will read whole books. That is not going to help. Don't go get ahead. Once you understand it properly, what are the main thing, try to make notes. These are the main thing, and then only go ahead. Don't read only and no, I have done everything, and if question are being asked, you are not able to answer. So another, at last stage, there are these are the some books. Do refer GPAT a companion by Inamdar ma'am, because as I said, read about four option. No, so this book has given detail about four option. What is about it? Another book I used to refer is GPAT Pharmacy Quiz, a handbook of pharmacy competitive exam by Samba Reddy. This is also good book. And another important thing is, while not now, at last stage, no, read Indian Pharmacopoeia general chapter. It is very important. You have to read this chapter. All general chapter regarding dissolution, regarding disintegration, and keep in mind, if you are reading disintegration, remember the mesh size. Remember the distance that vessel is falling. These are the questions. You don't remember value, but in this case, you have to remember value. These value are not going to change, and these are going to ask in exam. So I do refer Indian Pharmacopoeia, all general chapters. You do read it twice while going exam. This is another platform of starting test series, and you will find lots of guidance on PharmaFire. So you can contact, and if you need any help, please take help from PharmaFire platform. And thank you. Thank you very much for listening me patiently. And if you want to start it now. Don't tell that, okay, today lecture is happen and tomorrow I will start, later I will start. It's not going to happen. Start from today. All the best. Don't doubt your abilities. For moment in life, wish you all the best for exam. Thank you.
Thank you, Sagar, for your valuable presentation regarding GPAT. It is definitely benefited to our participant, and they will prepare accordingly. There are some questions from our participants, so I will ask you on behalf of them. So one of participant, Miss Snail, she asked, "Sir, which type of question are comes from pharmaceutics and analysis?" Hello, hello, Sagar. आवाज आवाज येत नाही ना तुझा. Yes.
Hello. Now you can hear me?
Yes. Can you please repeat your answer once?
Okay. So from pharmaceutics thing, no. So she was asking about pharmaceutics and pharmaceutical
Yeah, pharmaceutical
analysis.
analysis.
What type of question being asked? So if you consider, I will consider a general chapter, that is tablet and capsule. So what is tablet defect? What are coating defects? So read it thoroughly, I'll suggest. But anything can be asked. Example of anything, what is principle of anything. So for example, coating, what is enteric coating? Then in case of sterilization chapter, remember the class areas. So you cannot tell directly which question can be asked. Anything can be asked, but you remember that you are reading it properly and don't prepare like this type of question is being asked. So I cannot tell you the individual topic, that question being asked on this topic only. In analysis, do spectroscopy, do read detector, do read titrimetry analysis. Remember the detectors use, principle of detectors. Then uh, do read the sources, like that.
Sagar,
Yes.
are you hearing me? Yes. So can you please stop your screen? Stop sharing.
Okay.
Yeah. So one more question from our participant. Sir, how to begin preparation from first year?
So I will suggest, don't think right now, but whatever you are doing, you are thinking of it. That is very good thing, I will suggest. So start understanding in first year. You start understanding every basics of pharmacy. If you do your basics in first year and second year good, start your preparation from third year or at the last stage of B Farm second. I'm saying no because you are not now familiar with each and every subject of pharmacy. So do get familiar about subjects first. But if you are thinking of it, that is good thing. Whatever you learn from this point of view, try to understand it and uh, try to understand it and get all basic concepts clear from this point of view. Then it is going to definitely help you. It is very good thing you are started thinking of doing, means you are attending the GPAT seminar from first year.
Okay, thank you. So one more question from Ria Kerde. She asked, in ecology there are so many drug interaction, and it is not possible to remember each and every. So she asks you for a trick
Okay.
to how it will remember.
As I already told, no, remember common one, unique one. Find out what is the unique. Already told one example. Suppose anticholinergic drug, they have dryness of mouth as a side effect. So you have to find out unique. What is the unique, and remember that one. You don't have to remember common one. There are various common side effects. So don't remember that, but try to find out unique about every class.
Okay.
That I will say.
Yeah. So one of my student, Miss Apurva Maind, ask, sir, how can we prepare notes for pharmacology in GPAT point of view? So you will.
Notes. Uh, if you have to prepare notes, no, read the book first, and if you find something is unique, and note it down. Suppose, and for classification, no, if you read the classification as already told, note it down and paste it, and try to remember it. But preparing notes, sometime it is not good because see what syllabus is there and what things are there. So if you want to prepare notes of everything, it's not possible. Try to note down something important that you need to remember it. Uh, so you can recall it again. So try to note down that only.
Okay.
Don't prepare notes of everything.
Yeah. Thank you. So one more question from Vaishnavi Padole. She asks how to remember SAR, structural activity relationship, because she is a lot of confused in that.
About structure activity relationship.
Yes.
So what I will suggest, no, see in SR you have to remember the structure. So what it talks about, suppose if you have one bond, what is the function of that bond? So remember the structure first, remember the structure and then read the SAR. It will help you because you remember the structure. So first what you do, no, practice for remembering the structure, common structure, then read the SAR. Then that time you will remember the most of the things. So if you don't remember the structure and you are reading the SAR, that is not going to help.
Okay. So one of question asked by Mr. Saeed Imran. He asked need to cover human anatomy and physiology subject, means how to prepare for.
So I'll suggest for human anatomy and physiology. Na, why don't read it initially, but if you start reading pharmacology, suppose you start any chapter in pharmacology, go to back and read HAP chapter. So
Okay.
read it while doing pharmacology. That will miss your HAPs also get more clear, and you are reading pharmacology also.
Okay. Uh, so uh, so it's enough. Thank you, Sagar, for giving such a wonderful such a wonderful talk on how to prepare for GPAT 2021 or next. Okay. So now I request, as a part of our scenario, I request to Mr. Professor R.R. Thenge sir for vote of thanks.
Thank you, Ram. Good afternoon, everyone. It's my privilege to express vote of thanks to Sagar Chandne sir. He spent his valuable time with us and guide our participants regarding how to prepare for GPAT examinations. Okay. Sir has given a basic idea how we can prepare, which type of books we can refer, as well as how we can prepare the notes and many more. Okay. Thank you, sir, for your valuable suggestions and your guidance. I am also thankful to our management and principal, sir, that they will provide us a free hand to conduct such type of online activities for the pharma professionals. I am also thankful to our organizing team. Without them, it is difficult to conduct such type of programs. So once again, Sagar sir, I am very much thankful to you. Thank you
You are
very much.
most you are most welcome, sir.
Thank you very much. Now hand over to Ram.
So, dear participants, with the permission of speaker, I will conclude this session here. So, one notice for our dear participant. The second session will be start sharply at 1 p.m. So, please join us at sharp 1 p.m. So, Sagar sir.
Yes.
Yes. Thank you.
I hope this my talk is helpful to everyone, and thank you everyone for listening me patiently, asking questions. Uh, do contact me if you find any difficulty, but try to contact me on Saturday and Sunday. Definitely, I will reply you. Thank you everyone. Thank you so much. Thank you so much, sir.
Welcome. Thank you. So, so we will stop this session here.